Welcome back to third year. So we're going to discuss a little bit about what we are doing in third year because it's an advanced program from the second year. In second year, we are learning about the diagnostics and pathological aspects and those kind of stuff we are learning. Some Draviguna, the basics of Ayurveda, in Draviguna, all those things we are learning in the second year, right? Now we come to third year, it's even higher level. So we are going to start with preventive medicine. We have designed certain chapters which are suiting the Europeans also. There are lots of psychological disorders are there in European countries. So we try to not to disturb the syllabus uh, what we are doing in India. At the same time, we are trying to find a way in between for the Europeans also to understand and to support the Europeans' health also. In the same way, we try to reorganize a little bit here and there, but without disturbing the concept of Indian syllabus. So what we are doing here is Swasthavrata. We start with some Swasthavrata also, the Dinacharya, Ritacharya, and which is relevant to the disease manifestations. If you don't do Dinacharya, if you don't do Ritacharya properly, then what are the implications of those things that we are going to study in the third year? And again, we come back to the treatment aspect. Mainly here, Chikitsa Paddhati is very important. So we talk about the Susruta Chikitsa, we talk about the Charaka, all those things, we cover with Ashtanga, Hridaya, Vagbata, all those things we cover in the third year. Mainly here, we focus on the Chikitsa Sutram. Okay, and here we picked up some important diseases according to the European conditions and UK conditions. Also, psychological disorders we picked up at the beginning. So it's general medicine. More of in the third year is general medicine and its treatment and management in Ayurveda. Those kind of stuff we are taken in the third year. Psychological disorders, insomnia, depression, and bipolar, anxiety, Alzheimer's disease, and also we are going to discuss on that, and autoimmune disorders, which is much rampant in European countries, and Crohn's disease. We are going to discuss on that Crohn's disease and IBS, ulcerative colitis, and rheumatoid arthritis, and osteoarthritis, and gouty arthritis, and the lifestyle disorders like diabetes and hypertension, obesity, oncology. This is the most important problem the women, especially in European countries, they're facing with the breast cancers and all those stuff. And acid peptic disease is very common in Mediterranean countries, hyperacidity, gastric, and most important, what I see in European conditions is the uh, mm, diverticulitis or more in different parts of the European countries that we are focusing on how to reorganize Ayurveda according to the European health, because we are teaching here in European countries. So we need to focus a little bit about the European people also, and UK also. Oncology and Ayurvedic approach to the oncological diseases. This is really, really problematic problem. Diseases are there here. So we have a concerned specialities, specialist doctors who are teaching for the who are teaching the concerned subjects in the third year. Okay, we are bringing in Kaya Chikitsa people for all the general medicine, these things. So we are bringing in gynecologists to teach the gynecologists. So after this, we are going for Rasayana Vajikarana, infertility. Infertility is another big problem in European countries. The population is declining here. So we are focusing on the Rasayana, Vajikarana, all those stuff. What are major Rasayanas? This is another area of psychological, as a prevention. Ayurveda can be very useful for the European people because they are suffering with the mental diseases. And also Vajikarana and the infertility. That we have a lot of treatments available in Ayurveda for the infertility. Concerned teachers, they're going to teach on the subject. So gynecology, when it comes to gynecology, we have special professors are there, specialist professors are there. They're going to teach about these things. So menstrual cycles, uterine health. So basics of menstruation, all those things many people don't know. So we are trying to work on to make students to understand the basics of uterine health. So fertile female infertility, they will talk, and all those stuff, menstrual disorders, PCOS, PCOS, and other pelvic inflammatory diseases, and menopausal syndromes. So much of problems are happening in European. So we are going to focus on that area. So after that, we are going to do the Kaumara Bhritya, which is pediatrics in Ayurveda. So we're going to talk about the Ayurveda drug dosages, how to organize the dosages for the children, and all the stuff, and mainly immunity. We're going to focus on the children immunity. ADHD. This is another big problem in European countries. ADHD. We are going to work on that. Autism and bedwetting and mental retardations, all those things, cerebral palsy and Down syndrome, and the growth disorders, such kind of stuff we are going to um, discuss in the third year. So once you finish the third year, whole course goes for 10 months. And once you finish the course in 10 months, then we are sending the third year students to India for the clinical training. For now, we are working with Dr. Sarvepalli Radhakrishna University, Jodhpur, India. So they will be training there for 3 to 4 weeks, or maybe 3 weeks, and they will train that and they'll come back. So every 10 months afterwards, they will have an examination. All the years they will have an examination, which has been controlled by ATAB, Ayurveda Training Accreditation Board from India. Okay, thank you very much. And the rest of the details, please go through the links we give down, and please follow the website. All the details are mentioned in the website. Any students from any other countries, any universities in European countries or UK, definitely they can join the third year once they have a credible educational levels before. Then only we can take them into the third year. Otherwise, we are not taking just like that anybody for third panchakarma training. All these major treatment aspects we are not teaching until unless they pass through all the subjects before. Thank you very much.